Hi, my name is Dr. Odoyo Edward of Kisumu Dental Centre. I'm a dental surgeon, and today we are partnering with Ponea Health, and we are speaking about tooth cavities. Basically, a tooth cavity is a hole on the tooth, to put it simply. Now, tooth cavities are predominantly caused by bacterial activity in the mouth when they break down food substances, resulting in production of acid, which then eats away your tooth, causing a hole. Now, there are some things that might put you at risk for this kind of disease. For example, if you eat diet that is rich in highly refined sugars, then you will produce more of these acids which destroy the tooth. Another thing is if your teeth are weak by their own nature because of their form or because of their chemical composition, then it will be easier for the acid to attack the tooth and cause the cavities. Other issues are if, for example, if you have challenges that make it difficult for you to maintain good oral hygiene, then you are more at risk of developing tooth cavities. Now, who is more likely to get tooth cavities? It is anyone who is not able to keep their teeth clean, thereby allowing the bacteria in the mouth to stay on the surface of the teeth for a long period of time in the presence of this food substrate that we've already talked about. So the tooth cavity in itself is not genetic, a disease caused by the genetics, but as I explained earlier, there are some conditions which are caused by genetics which would cause your teeth to be either weak or poorly shaped, which put them more at risk for developing tooth cavities. Now, to know whether you have tooth cavities or not, first of all, there will be some symptoms. There's something you might feel that might show you that you could be having tooth cavities. For example, if your teeth are sensitive, that means your tooth hurts when you take something cold or something hot. If you have difficulty in chewing, or if you have bad breath coming out of your tooth, it might be an indication that you have a tooth cavity. Now, to confirm it, you need to visit a dentist to examine the tooth by looking out for these cavities. The dentist may need to take some x-rays to examine the hidden surfaces of your teeth, which may reveal if you have cavities. Now, there are certain things you should not do when you have a tooth cavity. One of them is to ignore the cavity. Ideally, you should have your teeth checked regularly, but anytime you have any of these symptoms that I've talked about, then you need to visit a dentist at once so that it is attended to. Now, some of the remedies that people use, for example, crushing aspirin tablets and putting it on the surface of the tooth, is not effective. Besides being harmful, as the aspirin, being an acid, can burn the tissues in your mouth. So the correct way to use these medicines, for example, is by swallowing the medicine, not by putting it on the mouth. Thank you for viewing this episode, and we invite you to join us again and check out our next episode. You can access our services by booking on ponea.com.